many highlights. This has been a busy San Antonio. Still, I haven't seen some presentation, but I will discuss of what I've seen up to now, and in particular this morning, I was pretty impressed by some data presentation. And one trial I think will bring soon a new drug to the clinic. And that was the CAPItello Phase III trial that tested the addition of the AKT inhibitor Capivasertib to Fulvestrant in a mostly second-line trial. And what we've seen in this trial is, first of all, that Fulvestrant, as we've seen in most of the trial, is really not an optimal regimen after progression to first line, particularly with CDKs. It had a PFS of about 3 months, that is really unsatisfying. But the addition of Capivasertib allowed to prolong this to up to 7 months. And so I really think this is very meaningful, statistically significant. The overall survival curves were also very promising in this trial. And what we need to understand here is that there was a clear benefit in the biomarker altered population that included mostly patients with PIK3CA alteration, but also other alterations. And that accounts overall for about 40% of the patients included. But there seemed to be a benefit also in patients with biomarker non-altered disease. And we need to understand if you can use this drug in the overall population or only in biomarker altered. I don't think we have all the data that allow us to understand this yet, but for the moment, this really is a good regimen for patients with biomarker altered disease. I expect this treatment to come to the clinic soon, and the tolerability was kind of, let's say, similar in some way, but also different from what we see with alpelisib. There is another agent targeting that pathway. With alpelisib, I have to say, we see more hyperglycemia and rash. We still see the rash with Capivasertib, but definitely less hyperglycemia, and this allowed also to include some diabetic patients in the trial. The enrollment was broader compared to SOLAR-1, but diarrhea was seen in 70% of the patients with Capivasertib. And so we really have to be careful about this side effect and learn how to manage it. And I hope in the future also we identify schedules that maybe can prevent or reduce the rate of diarrhea, and also maybe some prophylaxis can be studied. But in general, I feel excited about this compound, and CAPItello was one of the highlights. Other highlights were novel endocrine treatment regimens, novel endocrine therapies, and in particular we saw some exciting data from SERENA-2. That was a randomized Phase II data, a Phase II trial, showing that camizestrant improved progression-free survival at 2 different doses compared to Fulvestrant, and we also saw some promising data with elacestrant that previously shown to prolong PFS compared to Fulvestrant or AI, but now we saw that most of the benefit was in patients that were ESR mutant and with a prolonged CDK4/6 inhibitor treatment for more than 1 year before. And I think many of these trials are showing this, that the population that can benefit from sequential lines of endocrine treatment is that it has experienced prolonged duration of CDK4/6 inhibition, and that has ESR1 mutation, or in general is dependent to the estrogen receptor pathway. We need to get smarter at identifying these patients, but for the moment I think these 2 characteristics, prolonged CDK4/6 inhibition in the past more than 1 year, and ESR1 mutations, can help us understand which patient can benefit from single agent elacestrant or camizestrant, or maybe ARV-471, another interesting agent for which we saw promising data. And maybe the other patients instead might need combination treatment, or to move on to chemotherapy or to antibody drug conjugates. So a lot of exciting news coming, but in general I feel that we need to study endocrine sensitiveness and responsiveness better to understand how to tailor treatment for our patients.